I think the healthcare proposals that are on the table, whether it be Obamacare or a replacement that seems to um, still leave healthcare too much in the hands of insurance companies, are both doomed to failure. It is possible that the wisest option ultimately is single payer, which is what most other countries do. But I'd like to propose here another alternative. Um, I think the problem is we live in an egalitarian era where the assumption is that everybody deserves the same level of health care. I think that becomes untenable because there are so many people who are poor who at the same time have very high health care needs, and everybody else has got to subsidize them, which is making premiums untenable. And if it's single payer and everybody gets the same level of health care, the cost could be inordinately burdensome to the nation and to the individual taxpayers that are going to be paying the subsidizing of the poor. So what I'd like to advocate is a two-tiered system of health care. Just as a human being and just being humane, every human being by virtue of being here has a right to basic health care. And basic, we can argue about what basic would actually be, but I would define it as something like basic preventive care, getting to see a nurse practitioner, not of their choice and not necessarily instantly, but for health exams, wellness exams, and of course in emergencies, everybody gets access in emergency to the same level of care, excellent, as good care as we can possibly provide. But in the middle ground there, everybody would not, under my system, in an attempt to save some costs, would not get access to having a doctor as their primary care, not choose their doctor, not choose their hospital, not get a semi-private room, not get access they would get access to all procedures, surgical and medical, that have been proven to be cost effective. The highly low benefit treatments, like for example, there are some cancer treatments that are unbelievably expensive and have very little value that they've shown, they would not get access to those. I think that would reduce cost a great deal. Obviously, people who are paying into the system would have a greater amount of choice. I also think that a major driver of high costs is the large amount of training that is mandated especially for physicians. I do teach a bit at the medical school, medical students at UCSF, and talk to many of the students, and so much of what they learn really is unlikely to be of great benefit to them, and they're taught very heavily by theoreticians. Also, when I've had these conversations with practicing physicians, I have a number of physician clients in my career counseling practice, and really, while some of them say it was worth all the years, but many of them, when they can push aside the cognitive dissonance, say it doesn't need that many years. So I would take a hard look at reinventing training to make it shorter and taught mainly by master practitioners rather than by the academicians who largely control, believe it or not, even medical school. And I think that would lower costs, that would lower the sense of entitlement that physicians need to charge that much, not entitlement, because they spend so much. It costs $300,000 to finish medical school just at UCSF, which is a public school. The privates are even worse. So, they have to charge that much, and of course malpractice insurance is very expensive. So I think that shortening the training, having I'm not an expert enough to know exactly how, but to take a hard look at all the lawsuits and what can be done to reduce the number of lawsuits while still giving patients the right to sue, I think would go a long way to providing health care that is not going to result in real lack of access. It's one thing to wave your hands and say, I've got insurance. It's the other thing to be able to see somebody. I have a client just today who told me she's only got Medicare and no doctor will see her. She had a real exacerbation of her rosacea, and all she's got is a general practitioner who wants her to wait weeks and is not really an expert at this, or the emergency room. And that is a function of the fact we're trying to cover everybody when there's too few people paying. So that's my thought. Two-tier medical system, shorter training. Feel free to email me or make a comment here on this YouTube video if you think you've got a better idea. Anyway, I'm Marty Nemko.